For the last couple of years, perhaps more than ever before, the Serum Institute of India has come into a great deal of prominence after COVID. We've of course had Covishield, and that saved the lives of countless people across the world. But going forward, the world continues to face threats as far as the pandemic is concerned. Adar Poonawalla with us. Thanks very much for being with us, Adar.
Thank you for having me.
We all hoped that, a couple of years after COVID, the pandemic would be over at this stage, but it's not. The China story remains very, very real. What are some of your key concerns as far as China is concerned?
Well, I think from the last time we met and talked about this, Vishnu, we thought that the pandemic is almost behind us. It's very important for the world to get back to its supply chain issues and improve on investment and all that sort of stuff. If everyone in every country has gotten over this pandemic.
Yeah.
Now, that's where China and what's been happening there, unfortunately, and we wish them the best of luck to get out of this as soon as possible, because, it's better for the world if China recovers from this, is that until they're fully out of the pandemic and the infection rates that they have, it's not great from the world sentiment point of view. We're in a very good position, of course, as you know, and we need not panic because of having a higher than 90% coverage with a very good vaccine and herd immunity having built up because we didn't adopt a complete zero COVID policy. We're in a very good situation, and we're trying to engage with China and requesting them to set aside political differences or issues or apprehensions and take some of the Western vaccines or Indian vaccines as a booster.
So how have you done that? This is really important. Covovax is something you believe may have an impact, not just in India, around the world, but certainly in China. So you've approached the Chinese government, or how is that process working?
I don't know how much of that I can share, but both, through private channels and other channels, we're trying to get through to them. We haven't had a full response yet. I think they're just deciding on which way they want to go, whether it's even worth now introducing a booster vaccine with so many infections going on. I think that's a valid argument. I just hope that they decide one way or another very quickly. And the reason why we offered Covovax to them is because it's proven with its neutralizing antibodies and human trials that it works very well against Omicron and the subvariants.
Right.
In fact, 2 to 3 times higher response than even Covishield. So this is where, it is a useful booster for our citizens in India, for whomsoever wants it. And, because as the strains change, the older vaccines become ineffective toward the newer strains. And that's why, Covovax is very important, and people were asking about it, and that's why it's
and you've got data on it, hard data, and that's what makes it viable.
It is approved by the US FDA, Europe approved as a booster in 30 countries. Now, as soon as yesterday, the DCGI also approved it as a heterologous booster, which means you can take it no matter which other vaccine you've taken as dose 1 and 2. So, now it's all available.
So it's going to be in Cowin in what,
a
a week?
matter of a few days, a week to 2 weeks.
And have you decided the price?
It'll be at the same price as all these other vaccines.
Which is what approximately?
200-300 rupees or something.
Right. And now this is important because it's a new vaccine. We do face, a lack of boosters in India. So how effective is it for older people, for younger people? Is it safe with other vaccines which they may have taken?
Absolutely. We've done trials with Covishield, Covaxin as, a primary and secondary dose. We'll send you all the details and give you the neutralizing antibody data. It's very safe, and as I said, it gives 2 to 3 times higher response. Specifically against Omicron and the subvariants compared to even Covishield.
Right. And, there's so much that... before I get to the other vaccines, I found it interesting that speaking about Covishield, you've now got data showing its effectiveness compared to other vaccines as a booster. And this is new data which has emerged a couple of days back.
Yeah, but all these trials keep coming about, and I don't now generally want to comment on which vaccine.
One vaccine versus the other.
I think, all the vaccines are very good, and, different data points keep emerging and coming about. And but I think all the vaccines which are licensed are very good. They're very safe. So from that angle, I think there's nothing further to add.
India is the world's pharmacy, and the Serum Institute of India is the world's largest manufacturer of vaccines in the world. There are huge controversies. There have been a couple of unfortunate events with regard to the quality of Indian medicines. Now, you focus on quality more than anything else, right? I mean, forget the vaccine; it has to be. Tell us a little bit about that and your concerns, because India's image has also taken a bit of a hit.
Yeah, I mean, look, there might be some isolated one-off events, and even the matter that you're talking about is still under investigation.
The two of them, one in the Gambia, one.
See, I mean, to be honest, it's not fair for me to comment. It's under investigation. Let that whatever comes out of it. Now, the way I would respond to that is, if you compare with China, South Korea, any of the other East or South Asian countries where you see pharmaceutical drugs, our quality in India, this is why everyone here wants to invest in India and is looking at India, quality for all our products is top notch.
Right.
All the pharmaceutical companies, now even Serum is approved by US FDA, Europe. I mean, the kind of rigorous inspections they put us through really ensure that our quality systems ensure that there's nothing that slips through the gaps. Now, the companies you're referring to maybe not approved and of that standard, but I don't think India's image can be shaken just by one or two one-off events, isolated events. And yes, there may be some temporary doubt here and there, which sometimes even gets politicized and exaggerated. But I wouldn't think anything of it. I think India's image can't be shaken. Everywhere here you go, there's of course absence of the Russian and Chinese delegations.
Yes.
So where are you going to go and where are you going to cooperate? The theme today is of Davos is cooperation.
Yeah.
And everyone's looking at India, investing in India, cooperating with India. So these one-off isolated incidences will not, I think, have any impact on the image of India.
You are developing several other new vaccines as well. The malaria vaccine, and that's something that can save millions of lives.
Yes.
Where are you with that?
So we have just submitted to the WHO all the information. It is more than 77% effective, which is much more than anything else available on the market, and we are hoping to get regulatory approval for the continent of Africa by the end of this year, and rolling out by the end of this year, which is really exciting news.
Now, you're going to manufacture this in terms of development? Where is it? Who have you tied up with?
This is the Oxford. This is the original partnership that we had with the Oxford University. We've been working on it for years with them. And the phase 3 data has finally come out.
Which is what, 77%?
Yes.
77% effective.
For seasonal, and for the annual, which is non-seasonal, it's around in the same ballpark, but not vastly statistically off there. So, once the WHO looks at all that data, we will start manufacturing at some point this year. And hopefully in small quantities, roll it out on the continent of Africa.
And India, when?
So this is an interesting point. This is against falciparum. We don't have this parasite in India. We're developing the other one for India, which will come about.
Which is going to be based on this.
So this is for the continent of Africa, for the parasite we get in Africa. Claims millions of lives in Africa. So it will be hugely impactful. And if you look at the global issues, there's always been, a breakthrough that we've all been waiting for: malaria, TB, and HIV. And
and you've got it with malaria.
Yes. So
and the India vaccine specific to this to the insect over here
will take a little bit longer to develop.
That's going to take a little bit more time.
Yes.
So what, you're looking at a year, 2 years?
No, probably about 3 years or something.
3 years or so, okay.
But from India, from the mosquito problem, we are looking at launching in 2 years' time the dengue vaccine, which has already started trials.
2 years from now?
Yeah.
Right.
So
and you're at what, phase 1 or are you?
Phase 2 and phase 3. So should start soon.
These are single dose vaccines?
Well, no, there'll be 3-dose vaccines.
There will be 3 doses.
In fact, Vishnu, most vaccines are 3 doses. There are hardly any vaccines on the planet which are a single dose shot.
Right.
Because that's what the body needs in terms of boosting, and if you look at the immunological profiles that you need to build and all of that, you do need 2 to 3 doses for most vaccines.
The HPV vaccine, that's something else that's quite something.
Yes, the HPV vaccine, in fact, is going to be launched in the next few days or months.
Right.
We've got DCGI approval. It's going to be very small quantities for this year.
I see.
It's more of a symbolic launch also in terms of the innovation that can happen in India.
Right.
The first made in India cervical cancer vaccine,
Right.
HPV vaccine.
Right.
And the large capacities will come in from next year.
Right. And so, I mean, that's as far as vaccines are concerned. Just one or two more questions on
Sure.
the larger issue as far as Davos this year. What is your sense? It's fragmentation or fighting fragmentation, which is the big theme. Now, you have a huge role in that because you want to bring the world closer together as far as vaccines are concerned. What is your sense of Davos this year and the India story?
Well, I'm so happy that, something called the WHO Pandemic Accords. The Pandemic Accords that WHO is trying to get together. If you remember last time when we were here, I was advocating and trying to push for a global treaty.
Yes.
Now this is somewhat like that,
Right.
where you will have cooperation and hopefully signing up of all these countries,
Right.
cooperating and saying that, look, if there is another pandemic,
Right.
we will share raw materials,
Right.
vaccines, technology. Now to what extent,
Right.
all those details
Right.
will be hashed out.
Right.
So that the lessons from the pandemics in the past of where we did go a little wrong
Right.
in terms of vaccine equity, in terms of many other things, we learned from that.
How has
And
this
we have
document
things in
been
place.
accepted? Not just your document, or it's primarily the
Not my-
ideas within that.
Not my document
Yeah.
at all. It was just, discussions we've always been having with
Right.
different people. And the WHO, as I mentioned, you need a multilateral organization to take it up. You can't
Sure.
have an individual country
Sure.
taking up something like this to get all countries on board.
Right.
So the idea would be like what we've done on climate change.
Yeah.
Where countries have signed those commitments of
Right.
what they will do and
Right.
whatnot. So this is just a cooperation kind of treaty that during a pandemic,
Yes.
this is what will happen. Even things like vaccine certificates, global harmonization of regulatory
Huh.
standards,
Huh.
things we spoke about which
Huh.
was causing delays
Yes.
and non-acceptance of drugs or
Huh.
vaccines in
Huh.
other countries.
Huh.
This should hopefully, if countries adhere
Yeah.
to this strictly, solve that.
Huh.
God forbid there's another
Huh.
pandemic.
Right. Super.
So these are the sort of collaborative things
Things
we're
that you're
trying
looking
to
for.
do. And of course, it's a great opportunity here to bring investors to India and showcase the capabilities of India.
Right.
But I'm looking at that even from the angle of our finance company, looking at investors who may look at in the long term, investing with us. We've got our general
to this
insurance
end, yeah.
company as well, where we may raise capital, Magma HDI,
Right.
in the future to grow.
Right.
Including some mergers which we may look at for our insurance business later on.
Yeah.
As we want to grow in health insurance.
Are you looking to diversify even more going forward?
No, I think finance and general insurance, health insurance, I'll have my hands full.
Yeah.
And of course
The vaccine
our focus
business.
on serum. But I think there's quite an opportunity in the insurance and health insurance space in India with the
Yeah.
growing population and our health synergies which we have with
Right.
Serum Institute. It ties in nicely
Sure.
to offer good quality, affordable healthcare
Right.
insurance,
Right.
which completes the sort of circle of providing all of this to our citizens. So I'm focusing on all of this now.
Well, it's all incredibly exciting. We've been talking about the COVID vaccines, but
Yeah.
malaria in Africa,
Yes.
fighting that, 77% efficacy, absolutely unbelievable.
Thank
Always
you.
a pleasure speaking to you, Adar. Thanks
Pleasure.
very much.
Thank you
indeed.
for having me.
Thank you.